To get started with the appropriate administration of lactulose retention enema, please open the lactulose enema kit. Each kit contains one glass bottle containing 300 ml lactulose solution and an enema pouch. Make sure that the enema tube clamp is in locked position. Remove the cap from the funnel and empty the entire 300 ml lactulose solution into the pouch. Add 700 ml potable water to ensure that the level of the mixture reaches the 1000 ml mark on the pouch. The reconstituted solution should always be used immediately. Insert the cap over the funnel. Shake the pouch to mix the contents thoroughly. Loosen the cap slightly to allow air inflow. Release the clamp. Allow the solution to reach the tip of the enema tube. Tighten the clamp. Place an IV stand by the side of the patient to appropriately administer lactulose retention enema. Suspend the pouch at a height of 18 inches above the patient's anal opening. This height is needed to ensure passage of fluid to the right colon. Wash hands thoroughly with soap and water, and then dry them completely with a clean towel. Wear a pair of gloves, which need not necessarily be sterile. The buttocks are exposed, and a rectal examination is done slowly with a lubricated finger to rule out any painful anorectal pathology. The finger is then wiped off all the lubricant so that the gloves are dry. Measure up to 4 inches and lubricate this portion of the enema tube. Insert only 4 inches of the lubricated enema tube into the rectum, with the patient in the right lateral position or Trendelenburg position. Insert the enema tube gently into the rectum. Release the clamp to deliver the enema. Tighten the clamp after delivery. Lactulose enema should be administered as a retention enema. The enema should be retained for 30 to 60 minutes. Ideally, the entire 1 liter solution should be administered at one time. However, if the patient is unable to retain the entire amount of enema and the fluid starts leaking out, the enema should be given in 2 sittings of 500 ml each. After the desired time, evacuate the enema. Ask the patient to pass stools if the patient regains consciousness or improves from the comatose state. If the patient has not regained complete consciousness, cut the enema tube close to where it meets the pouch and release the clamp to evacuate the enema. Repeat the lactulose retention enema every 4 to 6 hours until the patient is able to take oral medication.